Hi, I'm Heaven. I'll be taking your blood pressure today.
And I'm Tim. I'll be walking you through a step-by-step instructional on how to properly take blood pressure. First, you want to make sure that your patient is in the appropriate position and that they stay quiet throughout the process.
Alright, I'm going to have you uncross your legs, feet flat on the floor, and turn at the top throughout this.
Second, lightly elevate their arm.
Okay. Lift up your arm, rest it comfortably here.
Next, you're going to palpate for the brachial artery. Then, you're going to place the cuff with the appropriate markings over the artery that you just found. Before you take the actual blood pressure, locate the radial artery and inflate the cuff until you can no longer feel a pulse. When you can no longer feel a pulse, add 20 to 30 millimeters of mercury to your reading to have a starting point for your blood pressure. Once you've determined the appropriate pressure to inflate your cuff to, place the stethoscope over the brachial artery with the diaphragm down and inflate the cuff to the indicated pressure. Once you reach the indicated pressure, slowly release the pressure at a rate of 2 to 3 millimeters of mercury per second, and listen for the sounds of the heartbeat to return. This will be your systolic pressure. When the sounds have stopped, this will be your diastolic pressure. Once the sounds have stopped, rapidly deflate the cuff. Congratulations, you just successfully taken your blood pressure.
As a primary care physician, it's important to know not only how to accurately take a blood pressure, but also how to interpret it and how to manage your patient afterwards. So we'll go through the different classifications of blood pressure and the appropriate management of each one. So if your patient has a systolic reading of less than 120 and a diastolic reading of less than 80, their blood pressure is considered normal, and management would just be to encourage them to follow up with their primary care physician within a year. If their blood pressure, the systolic, is between 120 and 129, and the diastolic is still less than 80, that's considered elevated. And appropriate management is to still encourage them to follow up with their primary care physician yearly. If their blood pressure reading is systolic between 130 and 139, or the diastolic is between 80 and 89, this is considered stage 1 hypertension. You should encourage compliance with any medications and ask that they follow up with their doctor within 1 month. For stage 2 hypertension, the systolic reading would be equal to or greater than 140, or the diastolic would be greater than 90. In this case, again, encourage compliance with any medications and ask that they follow up with their primary care doctor within 1 week. Once you get above those, there are different levels of hypertensive crises that we'll go through. The first one is severe hypertension. This is when systolic is greater than 180 and or their diastolic is greater than 110. They may have some associated symptoms as well. In this case, they should see a primary care doctor within 3 to 7 days. After that, we have hypertensive urgency. This is when the systolic is greater than or equal to 180 and the diastolic is greater than 120. In this case, your patient probably does not have a lot of symptoms, and in that case, they should be encouraged to follow up with the doctor in 24 to 72 hours. At the highest level is a hypertensive emergency. Again, the readings are the same, systolic greater than 180 and diastolic greater than 120, but your patient will have associated symptoms including headache, shortness of breath, or chest pain. In this case, they should be seen immediately at the emergency room by a doctor.
Before taking the actual reading, be sure to Before taking the actual pressure, determine an appropriate Before taking the actual pressure, determine an appropriate